Welcome, everyone. I am joined by Lorraine Pentello. Hi, Lorraine.
I think.
Lorraine is a sexological body worker, so she helps people reconnect with their bodies and also overcome shame and trauma, especially when that comes to changes to sexual function. And a little bit of context, Lorraine has been on my radar for years. And a few weeks ago, she reached out specifically to say that she started to work with men who had had prostate cancer treatment. And that made me think, well, we absolutely have to jump on a Zoom and have a chat. She told me so many transformative stories of men she'd worked with. And I thought this is such an amazing opportunity to talk about the role that stress and trauma and shame, all those mental aspects play when it comes to sexual function. And it's such, I think, missing piece in the puzzle when it comes to any kind of sexual function journey. Lorraine, I'd love you to explain to the audience, what is a sexological body worker, and also just a little bit about your professional background.
Thank you. Sexological bodywork, it's a mix of many different modalities and many different approaches. And the glue that holds that together is sexual embodiment. So that's kind of like sexual mindfulness. So there's techniques from Tantra, there's techniques from Taoism, there's a whole bunch of sexual anatomy and pelvic anatomy that goes in there as well. So it's quite scientific based, as well as having these more esoteric, gentle therapies mixed in there as well. There's also remedial scar work in there too. That's Dr. Ellen Head's work, and I also studied with her in depth doing that as well. The way that a sexological body worker works is using breath work, sometimes genital massage, sometimes not, sometimes anal massage, sometimes not. They can guide people in being able to do these things for themselves or guide their partners, or they can explain to them how they can do it outside of a session. So depending on what the client is wanting to work with, I might be working online with someone, so they might want me to guide them through a practice online. So they could be guiding themselves on a mapping. So that's working through, do I have any genitals hanging around? I have a penis right here. So that would be working through the different points, noticing what it feels like, trying some different movements and sending awareness and breath to this point and just working through the whole area. So this could take many sessions to get through if we're going really, really slowly. It depends how quickly we want to move with that. And that can be really good for helping the brain to reconnect to the genitals, especially if there's been a shock, like with a prostate surgery, for example. There might be shock in the tissues and the brain might need a little bit of a rewiring to help recognize the sensations that are happening in the penis or not happening in the penis.
People listening to this may even relate as a metaphor the idea of feeling disconnected from the brain right down to the genitals when things are not working as they used to. I'm wondering, could you unpack and break down for us a bit on how stress and trauma can have an impact on sexual function?
So when we experience stress, the natural reaction is that we move it through our body and we shake it off and get on with it. And that happens throughout the day. We're always experiencing stresses that shake us up and we get on with our day and we process it. But sometimes this response can get stuck in our body and we can go into a fight, flight, or freeze. And when we go into this fight, flight, freeze response, the amount of blood that we have in our body, we only have so much blood to do all the functions that we need our body to do. And we've got this extra blood that goes to digestion when we're feeling relaxed and extra blood that goes into sexual function. So a penis is going to engorge and so is a vulva. We have erectile tissues inside our body. And when we're frightened, what our body is thinking, it's thinking we need to get away from this danger. It's not logical thinking. This is not happening in the front of the brain. This is happening in the subconscious. So in order to get away from the danger, to run or to fight, that extra blood is going to go to the muscles. So the muscles can move. They can take us away from whatever perceived threat is in the back of our minds. So if we're coming to try and have sex and we're feeling this threat somewhere happening in the background in our subconscious, that extra blood isn't going to the penis. It's going somewhere else. And I mentioned scar remediation before. Scars can actually impact this further. So if we've had some scarring that is sort of impinging on blood vessels, so we've got slightly less blood going to that area,
Of course, if you know your sexual function has changed dramatically, you're in a sexual situation, maybe with your partner of many years, maybe a new partner, it makes sense that when that heightened stress would be occurring. And then, of course, blood flow is something that desperately is needed. With penile rehabilitation, it's all about blood flow. So anything that can help just to increase the blood flow that's going on downstairs is going to help. Could you give us an example of a man you've worked with who has had a prostate cancer treatment? How is your technique helping them with that?
I'm mixing many techniques together. So there are sexological bodywork as well as I do trauma therapy as well. EMDR stands for eye movement desensitization reprocessing, and also somatic regulation techniques. So I'll go into a case study first, and then I'll go into a little bit more detail of how these therapies work. So I was seeing someone about a year ago who was in their 70s, and prior to their surgery, they've been getting pretty good erections, especially for someone in their 70s. They've been getting quite reliable erections. They had just started a new relationship. They were very excited in that relationship, and things were going really, really well. And then they had their surgery. They still had some nerves intact in there, that their erections weren't as strong. They were still getting them. But the main thing was that their libido had gone down. And when a relationship is in those exciting stages, that's one thing that's really, really important. And this client was really worried about the effect that it was having on his relationship. So what we did to start with, we did some calming techniques to bring that response down. So these included deep breathing. They included certain bodywork techniques and a little technique called the basic exercise by Stanley Rosenberg. So I would guide him through these techniques to help to bring his stress response down. And then from there, what we did was we tried some body work. So we tried some mapping, like I spoke about before. We've tried some strokes. And what we noticed as we were going through this process is that the worries in the back of his mind were changing. So it was worrying about his relationship, but it was also starting to think about his surgery in a different way. So we were calming his nervous system, quietening it down, so that the fears that were in the back of the mind, that the stories that were behind this dysregulation were coming to the surface. So what we did then was we worked with EMDR to calm those stories. And it wasn't just the surgery that was coming up, because these traumatic, stressful stories, they can add up and add up and add up and add up and sort of build together. So we were working through some of the trauma that came from the surgery and some of the trauma that was happening due to this relationship breakdown. But then we were finding things from his past, things that had happened with his family, things that had happened, accidents he'd had, surgery he'd had when he was younger. All these little threads were coming through. And the beauty of doing this process is we can move through these threads quite quickly. And the process of moving through the EMDR treatment, it just sort of like pulled them up, like pulling weeds out of the garden. We go, oh, there's another one, another one, another one. And this completely shifted his experience. He was starting to feel more connected with his partner and really starting to feel like he was getting that spark back.
Oh, that's wonderful. What comes to mind is I'm wondering, how did his partner feel about him coming to see you? Because I think also I've got a question on my mind. I don't want to ask, but how sexual are your sessions with people?
Oh, thank you for asking that, Victoria. It might sound like it's a very sexual touch, and it can feel that way. It can feel quite erotic, but it's one-way touch. So in that way, it's a little bit more clinical. It's sort of the middle ground between really clinical medical touch and the touch of a lover. It's a space that not a lot of people have visited. It's quite unusual. So Sexological Bodywork is monitored by the Somatic Sex Educators Association Australia here in Australia, and also the Association of Certified Sexological Bodyworkers. If you're working with someone who is a part of these associations, they have a strict protocol that they move through. We use gloves for any kind of genital touch. Like I said before, it's one way, so it's me touching the client isn't touching me. And also, we're not allowed to have sexual relationships with our clients either. We also have to have insurance, indemnity insurance for our practice. Any sexological bodyworker that you're working with will And if they're part of these associations, we'll have to have all these things in line and be very professional. There's a grievance policies and stuff like that that are a part of these two organizations. So if anything goes wrong, you can go to the associations and make a complaint.
It sounds like a lot of intention is put into this being a safe space because, of course,
Yeah.
especially if you're dealing with trauma coming up, be
Mm-hmm.
so important that that has been thought out. I also wonder, do you work with partners and couples as well? Do you often have couples that will come to work with you together?
Yes, I've had couples that have come to work with me together, and the varying degrees to how comfortable they are. Like the client that I was talking about before, his partner was very comfortable. In fact, his partner wanted him to come and see me. She was very excited because she wanted to get back to where they were. She wanted to rekindle. And she was putting her own work in as well. She was seeing her own therapists about what was happening. They were doing a lot of relationship counseling as well. Some couples, they don't want me touching their partner, and it's totally fine. They don't have to. In that instance, I could just be talking to them. Some people will see me on a Zoom call and they just want me to talk them through. In that case, I will guide them on some exercises together so they know how to do the breathing. They know how to do the bringing awareness to these different parts of our bodies. Because if we haven't done this, we don't know how to do it. And you can read all the guidance in the world, but if you don't do it and you don't practice it, you don't know what it feels like. And other couples, if they're comfortable with me witnessing them, they might do the mapping or massage techniques on their partner, but I'll be showing them with my model.
And that actually reminds me of what some men might be thinking of right now who've taken Tess soft penis pleasure course.
Yes.
That's something I introduced to my audience about a couple of years ago because I wanted them to have something that was helping them connect back to their bodies. It's wonderful, I think, for there to be all these different ways that somebody can approach this complementary therapy, that it doesn't just have to be in person. And that, of course, opens up people who might be on the other side of the world, but they want to be able to access this work and be able to do it in the comfort of their homes.